Now, going to the analysis of the NEET PG examination, August 2025, I will be just going through the important recall analysis and what is the advice for the students and how much of a score some students might have secured. So, as far as the NEET PG 2025 examination is concerned, we know that we have got these subjects: anatomy, physiology, biochemistry, pathopharma, micro, forensic, PSM, medicine, pediatric surgery, orthopedics, optho, ENT, ops, gynae, radiology, dermatology, anesthesia. Now, important thing is that what was the percentage of questions which were asked from the each subject? It never follows a pattern, as it is said that there will be this many number of questions from this subject. So the protocol does not remain static. It is quite dynamic because of multiple facts. Number one thing is that if you say, for example, they say that this question has come from anatomy, say hernia, but this is also a question which can be put into a category of surgery. Dimensions of the pelvis, that is a question of gynae or anatomy. So there is a quite huge overlap between the questions asked and where you fit them. So as far as the percentage of questions asked, there's a pretty good overlap. So there's no boundary in these medical sciences that we say this question strictly belongs to a particular subject. Now, a question like the drug used in the treatment of dermatitis herpetiformis or any other dermatological condition, lichen planus, do you put it in medicine or do you put it in dermatology? So it is pretty overlapping, as a result of which I will not just be focusing much on the percentage of questions asked from what subject, but overall you have to remember that there have been certain important subjects which are major subjects. And from this analysis of this year's NEET PG, we could see that a major chunk of questions were asked from anatomy, surprisingly biochemistry, pathology, lot many questions asked, pharmacology, quite a good number of questions asked, microbiology, very, very important, preventive and social medicine or social and preventive medicine, medicine and subspecialties, including the derma and the psychiatry. Surgery, we had 15 to 20 questions, obstetrics, gynae, 20 questions. So important fact is that the number of questions are from these major subjects, and one cannot afford to get these subjects wrong. So that's very important. And the focus in the last few years has also been on these subjects like anatomy, social and preventive medicine, pathology, medicine and subspecialties, surgery and surgical subspecialties. Now, what were the other subjects from which the questions could not go in double figures? I mean to say that what we can say that we can classify them as minor, though speaking that we cannot afford to get any question wrong, but the minor subjects tended to be, first of all, physiology, forensic medicine, pediatrics, surprisingly a very low number of questions this year, and orthopedics less than 10, ophthalmology, ENT, radiology, dermatology had got a good chunk of questions, almost 8 to 10 questions were from dermatology, and anesthesia a lower number of questions. So, to sum it up, as far as this year's PG is concerned and the last year's PG is concerned, there was a bit of a difference because the number of questions in pediatrics this year were low. The number of questions last year asked in microbiology was quite high, and again an overlap between microbiology and medicine. So these are some of the important things which were there. Now, about the students who may be concerned about how they did well, how well they did, how bad they did, sorry to say so, but eventually the important fact is that quite a good number of questions as far as the analysis goes is that we can say that difficulty levels A, B, C, A being the highest level of difficulty, B being a moderate, and C being the easy type questions. So I could just assess from the feedback from the students after going through the papers that almost 45% questions were of a range in which student had to think a lot, and that's very good, because this is the range of questions which differentiates as above average student and an average student. So there were some of these questions which had these brainstorming to go through the concept, to go through the values, to look at the diagrams, to arrive at the conclusion. And you could not do it by just cramming and just going and reading those absurd notes, one-liners and all those things. So you had to have a pretty good concept about what the question examiner asked you about, and it could not be done by way of just I mean to say cramming up. So this was the cash point, 45% of the questions which I found that needed a bit of a concentration, thinking on the part of a student. Quite a good chunk of questions, 35%, which were in the range of moderately difficult. And I would not like one thing, that there was quite a bit of repetition as far as the last few years questions were concerned. So 10 to almost 25% of the questions were repeaters, and it's a very big issue, because one should not place these repeated questions again, because this tends to imbalance the whole concept of the examination. The question should be new, the question should be I mean to say checking a student's ability and just differentiating students. So it's a filter. The examination should be like a filter. That's important. So I have no problems with some of the questions being easy, so that the student gets a good time in overall assessing the paper, and these questions tend to give time for the more difficult questions. So that's very important. So the determining factor would be level A and bit of level B among in the NEET PG this year. Now, as far as the feedback from the students is concerned, so what were the types of questions asked? I could see that these questions, which are image-based questions formed a small chunk over there. And what are these image-based questions? So you were given, say, for example, a figure, and you were asked to say what the figure or the slide or the image showed. Then there was another type of question in which you were given a clinical scenario. So clinical scenario is given here up, and then there is a diagram which is given, and you were asked to just answer the question from a viewpoint of the clinical scenario given above as a description and the question itself. Then there were those radiological image-based questions where you were just asked to, I mean to say, determine the clinical diagnosis. Say the questions like identify whether it's an IVP, whether it's a QEV, number one. Number second, what is the clinical condition there, the hydronephrosis, the ureterocele, or certain other things like those, especially in radiology, and so many questions. But my point is that you have to be oriented with image-based section as well. And as well as you have to have those clinical scenarios in mind. What clinical scenario would look like? How would you diagnose or differentiate achalasia cardia from carcinoma esophagus and other modality disorders of the esophagus? How would you differentiate carcinoma pancreas from CA stomach, from hepatic metastasis, or from carcinoid? How would you differentiate glucogonoma? How would you differentiate insulinoma? How would you differentiate phacocytoma or VIPoma? So you need to have these lab values of the diseases. Say, for example, they might be giving a clinical scenario of a Cushing's disease, Addison's disease, or any other metabolic disorder. So you have to differentiate these things. That is very, very important. Now, so clinical related based questions were almost 45 to 55%. That's important, which was our shown there. And image based questions formed 15 to 20% of the questions, and the one-liners were almost, I mean to say, 30% of the questions. So basically a pretty balanced paper with certain, I mean to say, negativities, but overall the paper would have been done well by students who had studied well, because of a bit of a repetition from the last year's questions. Not that difficult paper, and being a moderate paper, I would say, for all practical purposes. Now, what would be my advice to the students who are appearing next year? And as far as the results of the students this year are concerned, I would say that a lot many students might have done good. I mean, say very good, because the paper was not very difficult. It was unlike something we found in NEET UG. But over here, the question was, I mean, say the question set was quite moderate, and students, many of the students might have fared well. Unfortunately, some of the students who might not have had a lot of concentration, might not have had, I mean to say, done well on the table. So I would be sorry for them. But thing is that overall, most of the students might have done well, and you expect a good competition. Now, as far as my suggestions to the students who are appearing next year is that there is no shortcut to success. I have been repeating this thing. I mean to say, type of notes, no type of shortcut to the success is there. The best thing is the standard textbooks. And what I mean by standard textbooks is books like Harrison's Medicine, Davidson's Medicine, in SPM, Park, in I mean to say radiology. You can just take some MCQ books in smaller minor subjects, books like Dingra, and in other subjects, books like Bailey, surgery, Schwartz, substantive, all the important topics should be studied from standard textbooks. Basic textbooks are very important. And the best revision and the Q bank would be what I have seen, that my books, Platinum Q bank and NEET PGQR, there is no comparison. I would just be very absolutely clear in them. I know the whole amount of hard work I have put in there, and you can have a bunch of people over there sitting, and they would compete the NEET PGQR and Platinum Q bank. It is not possible. So that's important. This I'm telling with a lot of confidence. Now, no shortcuts, as I mentioned, and I see many students wasting time in useless long videos. Basically, that is something, a commercial entity. I will not go into that. So don't waste your time on unnecessary long videos. You do not retain much from the videos. Make a habit of reading from the books, taking notes, jotting the points down, and that's it. Thanks a lot.